I think the mode with which we engage community partners who engage with older adults is relevant no matter what the goal is. So if the goal is to improve heart health, then to me, the trick to me has been how do we engage in those folks who can reach those who we want to hear and react and respond to our message. So, and that's seldom talked about. So for us, it's through Choose to Move, which is an evidence-based, community engaged program, which has an element of physical activity, but a really big element of social engagement as well. So as soon as I mention physical activity, we're immediately talking about heart health. So if we can get these folks to increase their levels of physical activity, even a little bit. I mean, the evidence now suggests that you don't have to run a marathon. You don't even have to wear spandex. I mean, you can just get out there and do little bits of something every day. So this is a low intensity physical activity counts. You can go for walks. You can go for a few short walks every day. Moderate intensity physical activity. You can walk a little bit faster. You can go a little bit further and so on. For older adults, I guess I would like to dispel the notion that a lot of older adults engage in intense physical activity because they don't, and they don't have to. They don't have to. So again, here we are. It's not, gosh, it's not rocket science. And I've been talking about this my entire career, but a little bit of physical activity, snacking on physical activity every day will improve your heart health. It also improves your bone health. So as long as we're doing an activity that's loading your skeleton and your bones are responding to that, so that takes care of bone health. If we're doing physical activities where you're in a group or engaging with one friend or two friends and you go for a walk, then that's improving social connectedness and that improves your emotional and mental health. So, there's no magic bullet, but if there were one, it might be physical activity, and that's been said for so long, as we've said this for so long, but it's very true. In the work that we do, we don't ignore them, but we spend less time at the ends of a curve. So there are those folks who are probably never going to, engage in physical activity. And it might be that they're too frail, they're unable to, or whatever the reason. So there's that end of the spectrum. And then there are those who are already doing it and they're always going to do it. Yeah, they're always. And then there are those in the middle who can be nudged towards doing more I mean, we're in Choose to Move, we're working with older adults who have engaged in less than 30 minutes per week of physical activity, so they're physically inactive by any definition, and we're engaging them, and I guess to me what's working, there's two things that are working, and one is giving them choices. So this choice-based program idea, so my choice, we don't prescribe physical activity. We just guide folks into choosing something that they like to do. And then in our group sessions and our counseling sessions, we help them to stick with what they've chosen. And if they're not able to do it, we switch that up, find something else. And so it's that idea, like we're not saying, okay, you have to do this many minutes. So this choice-based idea is working well, especially for older adults. But I guess the other aha for me, which I've already mentioned, is that we're working with community organizations who reach older adults to do other things. Reading group, a book club, a men's shed, a gardening club, or something else. And we're working with those community organizations to integrate aspects of physical activity into what they're already doing. So they're getting that social connection by going to book club. What about a group of individuals meeting and walking to this in-person gathering, if it's in person and not virtual, getting together, or connecting ahead of the book discussion and saying, can we all meet for a walk on the weekend? So integrating physical activity into what's already happening, as opposed to kind of plopping it down into people's lives. And then working with community organizations who have already reached these older adults. They've got the trust of these older adults. They've already engaged them in other ways. So kind of piggybacking onto those relationships. I feel very privileged in having had support from our funding partners to implement across 10 years now, Choose to Move, with over 8,000 older adults. And the formula that we've adapted and adapted and adapted depending on who we're working with. So that adaptation piece and us being flexible is key. And I'll come back to that. But the components of the program itself are a one-on-one session with an activity coach for each of the 12 to 20 older adults in the group. So what do you want to do? When are you going to do it? And then there's a number of group sessions. So once they have their action plan, here's what we're going to do. Then there's a group session every month where they get together with others, older adults, and talk about what they're doing, what's getting in the way of them doing it, how are others in the group coping with that, and the activity coach also doing a bit of a session on topics like eating well, falls prevention, heart health, or those topics, but a lot of that is connecting. And then there's the option to meet for the participants to meet outside of the group, and just to sort of keep that going. But that activity coach, I'm saying counseling, but they're not trained counselors. Peers can do this. Peers can do this with other peers. Just create a venue. And we're doing a lot of this virtually now with folks from all over the province. And just someone who engages folks in talking about what they're doing. And we did a little study called Next Steps where we tried to understand, once you've been in Choose to Move, which is 3 months, you've engaged in physical activity, and you've met up with folks, you've got these groups, and there's some social connectedness happening. And what do we need to sustain that? So we're out of the picture now. How do we sustain that? And we've learned from our study that there was these once per month group sessions are absolutely necessary for probably ever. So to our government and to our other funding partners, you just can't stop. You can't pull, you can't pull back. I keep saying you have to brush your teeth every day. You can't brush your teeth once and they're going to stay clean. You've got to engage all the time in keeping these folks, connected and active. And we do measure those physical outcomes, but quite frankly, I mean, most of the positive feedback, I mean, and I don't want to, I mean, I've got an amazing team that does this work, so I'm blowing their horns. This is not my horn. I have no horn to blow. These are just really dedicated and talented team that's out there in the community making that happen. And I mean, the language that comes back to us is, this has saved my life. I mean, my husband died. I was caring for him for years, and then I found myself alone without right. I lost all my connections, and then it's a free program as well, Courtney. So finding Choose to Move and then re-engaging back into the community, it gave me a new lease on life. We do get mobility comments. I've taken my first bath in 2 years because I can actually have the strength to lower myself into the bathtub. I can put my socks on. But I mean, this is not I'm ready for a marathon stuff. This is I can engage more fully in my life, and to us, that's the win. We have seen increases in physical activity, but really the big win for us is in mobility. We've seen increases in mobility, especially those who have mobility issues coming into the program. So what does that mean? Well, that means I can live independently for longer if I retain my mobility for longer. I mean, and mobility is closely linked with heart health. I mean, you have to have cardiovascular fitness in order to continue to be mobile. It's linked with bone and joint health. I mean, it's linked with all of these other systems. So we look very carefully at mobility. And we've been able to bring older adults who sort of are at that frailty threshold back over into being independent. And it won't last forever, but they can live independently and sort of hopefully richer lives for longer. We hear about that all the time. I've got tons of quotes from our qualitative research group of what folks have said about, and most of it is about interacting with other people. Almost all of it. It's not, oh, my heart feels stronger, or I feel, or my muscles feel. It's really, gosh, it's just a new lease on life, being able to re-engage with people. And for my mental health, we've done a really good job in this country and other developed countries in promoting and achieving longevity. So we're living longer, and yay, so check mark for that. But I guess I think what you and I are talking about is what is the quality of those later years? What is the quality of that longevity? And yes, we want our hearts to be functioning well. We want our brains to be functioning well. We want our muscles and our bones to be functioning well. And to me, it really, I mean, I'm of that age. And to me, my job as I get older is to move as much as possible. And again, you said I am not training for a marathon, but we have individuals who after COVID, and I think we talked about this last time, had not left their home for 2 years. So even just getting them out of the house for that, and it's not a 20-minute walk, it's to the end of the block and back. So if you're lying down, let's get you sitting up. If you're sitting up, let's get you standing up. If you're standing up, let's get you walking a short distance. And it all counts. I mean, if there were gold stars, everybody would get one. If you're walking 1 block, make it 2. If you're walking 2, make it 4. You know, that sort of thing. So that's incremental amounts of physical activity. You probably also know that heart health, we train our hearts a little bit differently. We want to do more and sort of move towards moderate levels of physical activity if we can. But if you haven't done much for a long time, it doesn't take much to get your heart rate up. So you do, again, it's just you can do what others might consider light intensity physical activity, but for you, it's hard work. So there's that. For bones like that higher impact and strength training related. So if you're able to do resistance training or do it safely and know how to do it, then that helps. That really helps our bones. I don't know the evidence around strength training and heart health. You might know more about that than I do. But if your heart rate's going up as a result of being in the gym, then that's going to promote heart health as well. And you said heart health, bone health, and brain health, physical activity is the same. Both of those together are going to keep our brains stimulated as well. And then again, mental health. And again, back to that magic bullet, I mean, there isn't one. You have to do a little bit of different kinds of things, walk further for your heart, walk a little bit more intense for your heart, do more weight bearing and sort of loaded physical activities for your bones. All of it works for your brain sort of things. But I think I love the fact that there's not these individual workouts customized for your heart, and here's something customized for your brain. Just get out there and start moving if you're an older adult, and it's going to help across all of these systems. I've got some much more talented people than I am doing this work. Megan Winters is a person who works specifically in the built environment, looking at how we can, reconstruct or redefine or the social and built environments to grow old well. But the work that we did was working with the City of Vancouver on 2 different greenway projects in Vancouver. And one was the Helmcken Greenway, and one was the Arbutus Greenway, and they run for, the Arbutus Greenway, I think it's 11 kilometers long. And so what we did is we talked to older adults, adults, and children who lived in the vicinity of these greenways and tried to understand who it is that's using them, why or why not, why are they not using them, and what would need to be changed for them to do so if they're not. And it was really interesting because, and there's lots of other built environment stuff, as you know, but for this project, older adults were not using this greenway because there were so many cyclists on the greenway. So they did not feel safe. So now here's a walking trail that goes for kilometers that has no cars, and they were actually more concerned about bicycles than they were about cars. They know how to navigate cars. There's rules of the road. They weren't sure there were on these greenways. The same as with children. Their parents were concerned about their safety. So the City of Vancouver separated the bike lanes from the pedestrian lanes, and I think there's a bit more usage. And again, Megan Winters evaluated this project. But the other thing in terms of the built environment as it relates to older adults, and part of the Helmcken Greenway project, and there's a paper by Calista Tony called Benches Are Like Porches. So what the city did is they put benches all along the Greenway. So that did a few things for older adults. It got them out of their house. They walked to sit on the bench. Others were walking to sit on the bench, and then they would engage socially on these benches. So something as simple as a bench being a part of a community network, that's walkable. Being aware of grade, being aware of where there's hills in these neighborhoods. And we haven't worked specifically in age-friendly cities, sort of studies, but there is a lot of work being done in how do you make cities age-friendly. But some of the built environment stuff, we ended up having fantastic relationships with the city of Vancouver, who had never previously had health as a part of their mandate. That belongs to the provincial government. That's not a city thing. So what we did was we ended up having that. It's now part of their strategic plan. It's a big part of that is health. So how do you build cities that improve health? To me, that was a massive win for us, thinking about health, making cities more walkable, making cities more bikeable, making cities safer, having green spaces and blue spaces and all of those things that contribute to mental health as well. If you don't know, if you think your only way to become engaged is just to go into one of these scary gyms where everybody's lifting 175 pounds or something, like nobody wants to do that. But there are a lot of, for example, walking programs. I mean, walking programs in almost every community, regardless of the size, has a walking program. And sometimes the church coordinates the walking program. Sometimes we've got in rural and remote parts of British Columbia where the health clinic organizes the walking. So the clinic is the hub. So it doesn't have to be community centers, but just to look for those, those outlets in your community. Find a friend to figure all this out with you. Find a family member to figure out with you. I'm not going to suggest for a second it can be intimidating for sure, but the return on taking that step investment, the return on that investment, as for heart health is so huge. It's to me, honestly, I think after the age of 65, our jobs are to move. Our job is to move and stay mobile so we can engage with our grandkids, we can engage with our communities, we can engage with the things we like to do. It's not, it's a choice in what we do, but I don't think it's a choice in whether or not we do it. Do something, and it doesn't matter what it is. So those are a few little tips. I think that it took, it's only taken me 25 years to figure out that we've been knocking at the wrong door with physical activity, right? I mean, people come for the connections, they come for the people, they come to meet others, and they will incidentally achieve heart health benefits and bone health benefits by being physically active with those people that they become attached to. So honestly, we begin now with social connections, and then we sort of build in elements of what you can do together to improve other aspects of your health. So I'm not a fan of hard-nosed prescribing, and I'm not a fan of report cards that says you failed if you didn't do this. I'm just not a fan. I mean, we all do the best we can. And if everybody's helping everybody do the best they can, then I think we're going to get there, especially with older adults.